But joining me now on a totally different issue, we've got breaking news for you here. Professor Joanna Howe, a former Rhodes Scholar, now law school academic. You'll know her as someone who's fought a long and hard fight to defend the human rights of babies born alive following an attempted late-term abortion. Well, she's taken on another fight. She's in the trenches again, demanding the New South Wales Premier stop a radical bill from the Greens that was tabled last night in the New South Wales Parliament. As I said, it looks like she might have had a win. Joanna Howe joins me now. Well, Joanna, more strength to your arm. What has happened? What can you tell us now?
I've just rushed from the chamber, Peta, where we have breaking news that the first very bad thing that this bill does has been defeated. So the bill gave a power to the Minister for Health to order all hospitals, Catholic, Christian, any hospital in New South Wales to perform abortions, and the hospital had to comply. And so, as I said at the start of March, this has the potential to end religious freedom in our country. And because of the showing of 10,000 people who came out last night, in the dark with their kids, you know, just ordinary folk, came out to say this cannot happen in New South Wales. One out of the four very bad things in this bill has already been defeated. It's going to be a long night. There's a steep mountain we have to climb, but I'm very excited and a bit emotional, actually, at the fact that together we've achieved something I didn't think would be possible.
Look, you've got a right to be. You have an absolute right to be. I spoke to Tony Abbott last night. I know he went down and addressed your rally. He said this was an assault on freedom of conscience. What I don't understand is there are hospitals and GP clinics across the country that offer abortion services. So to force those institutions that do not, based on their religious values, is a line that Australians have never, ever voted to cross. So what's driving this agenda?
So, look, in Australia, you can get a telehealth abortion in any postcode, in any location, and it can cost as little as $6.80 to end the life of your child. So cheaper than a milkshake. And that's how much the federal government subsidises abortion. And the reality is the smokescreen that the Greens have used for this bill is to say that it needs to be accessible in rural and regional areas. Chris Minns, the Premier, during the election campaign, came out and said that this bill will decimate the health workforce because midwives and nurses are not going to want to do this, and he said it's an affront to religious freedom. And in the election campaign, we saw Albanese talking about how he'd come back to the faith, crying over the death of Pope Francis, going to St Mary's on Easter Sunday. He was with the Greek Orthodox in the evening. You know, they were courting the religious vote in Western Sydney, where they knew those electorates voted against same-sex marriage. They're deeply conservative electorates, and Labor fooled religious voters into thinking that they would be on their side. And within one day of Albanese winning, Chris Minns did a grubby deal with the Greens to ram this bill through the Parliament, despite all the assurances that they were going to block this bill. So it is a massive breach of trust from Labor. And what I think is driving this bill is a pro-abortion ideology deep within the Labor Party because of Emily's List, because of that underground militia of pro-abortion women who have this as their number one agenda item. And they've worked behind the scenes with Amanda Conn, who's an abortionist in the Greens, who's leading this bill in the Parliament. And what they want to see is an ideology where none of us can dissent. You and I, Peta, or any ordinary Australian or any ordinary health worker who doesn't want to do abortions, doesn't want to perform abortions, believes that abortion ends the life of an innocent, vulnerable child, indeed our youngest Australians. The Greens and pro-abortion Labor want to make sure that we're not allowed to think that, we're not allowed to believe that, we're not allowed to act on that.
And of course, I made the point last night, once you extend it into abortion, you're extending it into, say, euthanasia. There'll be no line that's available to any health worker or any worker to exercise their conscience. Just quickly, I'm almost out of time. You mentioned 4 elements of the bill. You defeated 1. What are the other 3?
Look, the second aspect of the bill removes all data keeping requirements on abortion, just essentially pushes it underground. The third element forces doctors to be involved in abortion. They have to actively transfer, which makes them morally complicit. And the fourth element, which is the one I'm most worried about because my sources tell me that this is the one that Chris Minns and Labor want to push through, is the ability to turn nurses and midwives into abortionists. If this passes, this will make it even easier to end the lives of innocent innocent babies in this state. And if it does pass, my message to New South Wales Labor is we know what you've done. We see through you. And the 10,000 people that were there last night, we are passionate over the next 20 months of making sure that you do not form government again in March 2027. We have long memories, and we want all of this bill to be gutted. It has no place in a democratic country like Australia.
Joanna Howe, thank you for that, and thank you for the synopsis there, or the simple understanding of what was promised prior to the election, as you say, to court the vote in parts of the country that Labor needed to win, and where we are now tonight. Thank you for joining us, and well done, at least on getting that bit changed.